So next up, we have Adam Carell, who will be talking about using AI and natural language processing to identify imaging follow-up recommendations.
Great, thank you. Good morning, everyone. I'm Adam Carell, CEO of Within Health, and we're going to discuss using AI and natural language processing to identify imaging follow-up recommendations. First, disclosures. Within Health had developed the AI and NLP process that was used in this study, and we worked with a large academic hospital institution to acquire the reports that we used. So first, I'll start off just kind of some background, why we did this and what the purpose was here. Turns out that about 50% or more of non-urgent follow-up recommendations each year are either delayed or completely missed in being communicated to patients. Every adult in the US should expect to experience this at some point in their lives, and it results in about 80,000 unnecessary deaths per year. On the financial side, it's about a $20 billion missed revenue opportunity for radiology groups or departments. These are exams that should be taking place that haven't. And it's a huge liability issue. About 1 in 3 malpractice cases tend to result from miscommunications around these recommendations. So this is really the motivation behind this study, and we wanted to look and see if NLP could improve these numbers. So our hypothesis was that by applying AI and NLP to radiology reports, we can accurately identify dictated follow-ups by extracting key data from the radiology report text. And we can do this in less time than by manually tagging reports for follow-up. Okay. So our methods here were, we applied a rules-based natural language processing algorithm that we developed to radiology reports. We created 5 rules that were applied to see if a recommendation was present, and we'll jump into what those rules were and why in a minute. And we looked at about 1,400 randomized reports. These were all dictated by board-certified radiologists from a single academic hospital system, multi-site hospital system, and that was the basis of this study. And the way we did it was by manually tagging all these reports. We had 3 staff members that were trained on the same rules that the NLP would be using, and they read and tagged all the reports as they thought they should be. So whether a recommendation was present and what that recommendation was. And finally, we measured the accuracy of the NLP algorithm compared to the manual tagging and the time that it took to complete these tasks. So the rules that we applied for our natural language processing algorithm, really 5 simple things. We looked at, did a case include an imaging specific follow-up? Did it contain a modality, CT, MRI, the word imaging, things of that sort? We excluded cases that were not specific if it was an imaging follow-up. We also included interventional procedures, fine needle aspirations, et cetera, as those are to be imaging follow-ups as well. And many reports contain multiple recommendations. So we tracked each of those recommendations separately to make sure that we captured everything that a patient would ultimately need to take care of. We also excluded cases, like I said, that don't recommend imaging follow-up. So if a radiologist dictated something that said per guidelines or per protocol and did not include an imaging specific terminology or recommendation, that was not included in this. And we also excluded direct visualizations and biopsies without imaging or other specialty visits. So really just focused on imaging follow-ups here. And it was a fairly simple experiment, but I think the results were pretty impactful. So we determined that NLP could accurately identify positive recommendations. We saw about a 98.2% sensitivity rate, so true positives, and a 77.5% specificity rate. So there were a fairly large number of false positives here, but the rate of tracking down the true positives was very high. Also really important was the time it took to do this. So NLP processed these 1,400 reports in under a minute, where it took about 93 hours of manual tagging. So about 4 minutes per report for a human to read and determine what was there. So our conclusions for this were that NLP and AI can be accurate and useful for identifying recommendations, as well as the associated details. So being able to extract the time, modality, and anatomy is also really important, not just determining if a recommendation is there. It's helpful in identifying the at-risk patients, meaning patients that haven't returned for a follow-up that they necessarily need, and targeting them for an intervention, which could be a phone call, a letter, a digital message, email, whatever it may be. And this can also enhance and complement manual workflows and reduce administrative time. So obviously you saw with 1,400 reports, 93 hours is a significant amount of time to reduce. But most importantly, we wanted to look at what real world applications this could apply to, because this is all well and good in a study setting, but how does this translate to what's actually happening in the world? And by being able to identify these follow-ups using AI and NLP, there's a huge opportunity to improve patient care, make sure patients are receiving these follow-ups on time and appropriately. So that's saving lives and improving outcomes. There's a revenue opportunity here. Can we capture and bring back patients for these follow-ups that have a value to the hospital systems and radiology practices? And can we reduce costs and inefficiencies on the administrative side, as well as time spent by radiologists tagging reports? Can we take that off their plate so they can ultimately spend more time reading images and focusing on patient care? So in a real world setting, I think it starts with natural language processing and identification, and then downstream of that, there's potential for communications and scheduling and closing the loop on these recommendations. That is our presentation. If you have any questions, please feel free to reach out, and we appreciate your time. Thank you.